All right, everyone, welcome back to the channel. Today, we are diving into the absolute heartbeat of nursing school, prioritization. This is how you survive the NCLEX and, more importantly, how you keep your patients safe in the real world. When you see a priority question, don't think about who is the most annoying or who is complaining the loudest. You have to ask yourself, who is in the most danger right now? We are looking for the patient who is going to decline or literally die if you don't step in immediately. See this table? Nursing school loves to trick you with patients who are stable, patients who need teaching, or people in chronic pain. Those are important, but they aren't the priority. We care about the ticking clock. In this video, we're going to break down exactly how to spot that one patient you need to see first. Let's keep moving. Now, let's talk about the gold standard for prioritizing, the ABCs. This stands for airway, breathing, and circulation. If your patient can't do these three things, nothing else matters. Specifically, let's look at B for breathing. This is all about the movement of oxygen. If you see a patient with low O2 sat, respiratory distress, or cyanosis, which is that bluish tint to the skin, you need to move fast. Think about a severe asthma attack or a COPD flare-up. These breathing problems become deadly in a heartbeat. If you hear absent breath sounds, that is a massive red flag. It means no air is moving at all. That is your priority patient. Let's jump into the next part of the ABCs. Next up in the ABCs is C for circulation. You have to ask, is blood actually getting to the organs? Because remember, even if the lungs are full of oxygen, it doesn't do any good if there's no blood to carry it to the brain and kidneys. Watch out for signs of shock, severe bleeding, or very low blood pressure. If you see chest pain or weak pulses with cold, clammy skin, your patient is not perfusing. That is a circulation emergency. All right, we've got the basics of B and C down. Now, let's see how they stack up against each other in the actual priority order. Here we go. Now, usually the order is airway first, then breathing, then circulation. But here is the secret sauce. Don't use it blindly. You have to use your nursing judgment. Look at this scenario. Patient A has a stuffy nose. Technically, that's airway, right? But patient B is actively bleeding out from a wound. Patient B is the priority because the bleeding is a life-threatening circulation issue, while the stuffy nose is just minor stuff. Don't let the exam trick you with minor airway or breathing issues when there's a major circulation emergency staring you in the face. Always ask, who is going to die first? Now, what happens if the ABCs aren't the problem? That's where Maslow comes in. All right, let's shift gears to Maslow's hierarchy of needs. Think of this like a ladder. You can't climb to the top until the bottom rungs are solid. In nursing, we care most about that bottom level. Level 1 is your physiological needs. This is basic survival. Oxygen, fluids, and even pain management fall here. If your patient isn't breathing or their heart isn't beating, they aren't worried about their self-esteem, right? Once they are physically stable, we move to level 2, safety and security. This is where we worry about things like fall risks, infection control, or if a patient is confused and might pull out their IV. Important? Yes. But survival comes first. Levels 3, 4, and 5 cover things like family support and self-worth. In the world of priority questions, these are almost never the right answer if a physical problem is present. So, how do we choose between ABCs and Maslow? Let's break it down. A lot of students get confused on which one to use. Here is the simple trick. Use ABCs first if someone is actively crashing or there's a life-threatening problem. If you see oxygen, heavy bleeding, or signs of shock in the options, grab the ABCs immediately. That's your winner. But if the options are more general, like one patient is in pain and another is at risk for a fall, then you switch to Maslow to rank those needs. Basically, ABCs is for the emergency room crashing vibe, and Maslow is for the general floor management. Got it? Cool. Now let's look at another layer of prioritization, acute versus chronic. Next rule, acute versus chronic. This is huge. Acute means it's new, it's sudden, or it's rapidly getting worse. Chronic means it's long-term and expected. Look at this example. Patient A has COPD with an O2 sat of 91%. That sounds low, right? But for a COPD patient, that's their normal. It's chronic. Now look at patient B. They have new shortness of breath and an 88% sat. That is a sudden change. Sudden changes are dangerous. Whenever you see words like new, sudden, or worsening, your nursing alarm should go off. That patient is your priority. Chronic patients are stable. We know what they're doing. Acute patients are a mystery, and mysteries can be deadly. Next up, stable versus unstable. This is very similar to acute versus chronic, but focusing on the current state of the patient. Unstable patients must come first. We're talking about new confusion, signs of shock, or a decreased level of consciousness. If your patient is having a seizure or their blood pressure is tanking, they are unstable. On the other side, a patient with mild pain, someone who needs discharge instructions, or someone with a condition that is behaving exactly as expected, those people are stable. They can wait while you save the unstable patient. Pro tip for you: always watch that level of consciousness. If a patient is suddenly sleepy or confused, they are unstable until proven otherwise. Okay, let's look at one more crucial comparison: actual versus potential problems. All right, let's talk about things that are actually happening right now versus things that might happen later. The rule is simple. Actual problems usually beat potential problems. Think of it like this. If a house is on fire, that's an actual problem. If a house has a pile of dry leaves next to it, that's a risk for a fire. You're going to put out the house that's currently burning first. So, in a nursing question, if you have one patient who is bleeding and another who is at risk for falling, you deal with the bleeding first. Risks are super important in nursing, but they don't win the priority game over an active crisis. Moving right along to assessment versus intervention. One of the biggest questions in nursing is, do I assess or do I act? Generally, if you don't have enough information, you need to assess first. You can't fix what you haven't measured. If a patient says they're short of breath, you need to check their O2 saturation and listen to their lungs. You need that data. However, if the patient is clearly in immediate danger, like they are choking or their heart has stopped, don't waste time assessing. You jump straight to intervention. Basically, if you have time to get more info, do it. If the ticking clock is at 0, you act. Got it? Let's check out the next rule. Least invasive first. Now, let's talk about the least invasive rule. If you have a few actions that all seem correct, you want to pick the safest and least invasive one to start with. We don't want to bring out the big guns if a simple fix will work. Take a patient with shortness of breath. The very first thing you can do, the least invasive thing, is just raise the head of the bed. Gravity helps them breathe. It's safe, it's fast, and it doesn't require a doctor's order in most cases. Don't go straight for intubation or heavy meds unless it's a massive emergency. And whatever you do, don't just call the doctor before you've even assessed or tried a simple nursing intervention. We are nurses. We act. Speaking of which, let's talk about that call the provider trap. Let's keep this train rolling. In priority questions, call the healthcare provider is almost always a trap. Why? Because the exam wants to know what you can do as a nurse. If you haven't assessed the patient or tried to stabilize them, what are you even going to tell the doctor when they pick up the phone? You need to have your data ready. Vitals, assessment findings, the whole 9 yards. Only then do you make that call. All right, we're getting into the home stretch. Let's look at some common priority keywords you'll see on the exam. Ready for the next chunk? When you see words like first, initial, or most concerning, your brain needs to flip into priority mode. These aren't just suggestions. They are telling you that one answer is better than the others because of timing. It's all about the order of operations. Moving on to some real-world examples to tie this all together. Look at this scenario. Who do you see first? The itchy skin? No. The discharge teaching? Definitely not. The chronic pain? Nope. It's the post-op bleeding. That's a C for circulation issue and an actual problem. That's your winner every single time. Let's do one more before we recap. In this case, the new onset of chest pain is the dead giveaway. It's acute, it's unstable, and it's a circulation issue. The others are either stable, chronic, or expected. Easy as pie once you know the rules. Let's wrap this up with a final recap to make sure you've got it all down. And that is how you crush prioritization. Remember, ABCs for the crashers, Maslow for the basics, and always pick the acute, unstable, and actual problems over everything else. You've got this. Thanks for watching, and I'll see you in the next one. Class dismissed.